I'm still not signed in though.
Turn the recording off.
Go ahead. Hey, Carmela. Can you hear us?
Yes, we can hear you.
Okay, so look, I think Dr. Mancini, if she's not there in a few minutes, we'll get started from this site.
Yeah, she said that she probably wouldn't be here on time, so to go ahead and start,
Okay.
for you to start.
Want to do it now?
Close. Ready. So are we, is all the sites?
Yep, they're all live, they're all fine.
So what do they just see you and I ready? Say it with me.
No, I don't want to stay here. No, you're ready, you're good to go. Oh, wait, there's another nurse coming.
Hi. Carmela, you ready?
Yes, sir.
Okay, good evening, everyone. My name is Perry Harker, Carteret Community College. Want to welcome you. This is our last series of 4 with using our USDA equipment. We're calling this Carteret Links, and tonight we're going to focus on managing your blood pressure. On behalf of our president, Dr. Mancini, she's running a little bit late. She'll be coming in at at the bridge in just a few minutes. But she wanted me to help welcome you here tonight. We're glad that you've taken the time out of your schedule to be here. You're in for a very great presentation. We have Ms. Carmela Markham, who is chair of our nursing program. She has over 40 years experience in nursing, in the nursing field, and she's gonna talk tonight about how we can do a better job and improve our managing our blood pressure. Want to welcome all of the sites. We have Fort Benjamin online, Carter Community College on our campus in room 322, I think it is. And we're also at the Western Carter Library. And I have the delight to be here at one of our off-campus sites, the Harlow Community Center, the Cadet School. So we're delighted to be here tonight. We have a couple of their board members here, some of the community members that are here to participate. And at each of our sites, we have nursing students. And I'm sure Carmela will speak a little bit to that and introduce some of them as we get going. So in order to be mindful of your time, we're going to get started. Carmela, you ready?
I am indeed. Thank you.
Thank you. So turn it over. Thanks again for being here tonight.
Okay, I'm gonna. Welcome, everybody. Thank you for being here. We're excited about sharing managing blood pressure with you. I'm gonna pull up a couple of things on the screen, but I want to make sure everybody has a handout and that you've signed in on the roster that was provided. So if you don't have, there should be a couple of pages of handouts. So make sure you have 2 pages of handouts and we're going to get started. All right. So again, welcome. We've got a couple of people that are coming in. Share the sound.
Oh, what do you want to see about her?
Right. Can everybody see the screen now? Good. Right, we're talking about blood pressure. And the first thing I wanted us to talk about is why in the world does your blood have to have pressure anyway? Any ideas, any thoughts about that? Why do you have to have a blood pressure? Yeah, so somebody in here said, because so it can make your heart do what it's supposed to do. That's part of it. Any other thoughts from any of the other groups? I know some of you are talking, but I can't hear you. You got to unmute when you're. Any other thoughts about why your blood has to have a pressure? All right, so the blood pressure is caused by that difference in the pressure between the heart and the smaller branches of the arteries and veins. It has an effect on everything, literally everything in the body. And I want you to imagine just for a second, especially you men in the group, although some of us women have had some experience with pumps as well. But imagine you've got a water pump or just even a faucet and you've hooked a hose to it. So if there's no pressure coming out of that water faucet, what happens to the water at the end of the hose? If there's no pressure, what happens?
There's no water.
There's no water at the end of the hose. That's exactly right. So if there's no pressure in your body, then that's what's happening in your body at the end of the hose or at the tips of your body, like your fingers and toes and things like that. Well, let's talk about what happens to that hose if the pressure is too high. So for some reason, the water pressure just got so high, or if you got a water pump. Some of us, especially down east, have water pumps in our yard. And if that water pressure is too high in that pump, what happens to the hoses that's connected to it? What can happen to them? All those people are pretending they can't hear. What do you think happens at the other end, or happens to the hoses?
They burst.
Yes, they can burst. Exactly. Thank you. Welcome, Dr. Mason. They can burst, and that can be a real problem, obviously, with blood pressure. So we want to make sure that we do a lot of things relative to that blood pressure. So that's what we're talking about tonight. Most of the information that I have that I'm sharing with you is coming from the American Heart Association. They have a lot of interest, obviously, in maintaining blood pressure. So let's talk about the numbers. Whenever you hear about blood pressure, you hear two numbers, the top number and the bottom number. So the top number, what does that mean? It's the systolic pressure. That's the big word. That's the medical term, but it's really just the first number. What does that mean? It means it's the pressure in your blood when the heart beats. So the work part. So that's why that number is higher than the other number, or the diastolic pressure, the bottom number, or the second number, because that pressure or that number, it indicates the pressure when the blood, when it in the heart is resting, when the heart is resting between beats. So obviously that pressure needs to be lower. So that's why there's a top number and a bottom number. So two numbers for you to think about. So which number is more important? For years, we have always paid more attention to the top number. always worried about what that top number is. And over the past couple of years, we've learned that even the bottom number means a whole lot. We'll talk more about what those numbers are and why it is so important. But most people, their systolic pressure does rise, especially with age, because as we age, those arteries, and again, think about the hoses that are coming out away from that pump. So those arteries, even those large arteries, can get stiff. And when they get stiff, it's harder for that heart to pump, which means the pressure increases. There can also be a long-term buildup of plaque inside of those arteries. Plaque comes from things like cholesterol, but there's another thing that can cause plaque to build up, and that is sugar. So if you have an increased sugar, we sometimes call that diabetes. Okay, so if you have diabetes, you can have an increased sugar plaque because sugar has an affinity to protein, and that can also build up inside of those blood vessels, which can cause cardiac and vascular disease. Cardiac means related to the heart. Vascular means related to the rest of the vascular system throughout the body, all the blood vessels in the body. So either one elevated, the systolic or the diastolic, so the top number or the bottom number, either one of them can cause you to have a diagnosis of high blood pressure. And so that's why we're looking at all the numbers now when we're checking blood pressures. Remember, one of the things that we are trying to prevent are things like strokes and heart attacks, because with the increased blood pressure, it can cause a patient to be more susceptible to these complications of hypertension. So that's why we want to control those numbers, especially in people that are 40 to 89, which I think are most of our invited guests tonight. All right. So this table that you have on the screen now, you also have on the handout. So if you look at your handout, the one with the man that says blood pressure measurement instructions, down at the bottom, there's a handout that says American Heart Association recommended blood pressure levels. All right, everybody with me on that? And I like this chart because it's color coded, and that's why I made sure that yours is color coded as well. So anything in the green is normal. So remember, we have a top number and a bottom number. Systolic is in the middle column, diastolic is in the last column, and the systolic should be less than 120, and the diastolic should be less than 80. So normal blood pressure, 120 over 80. Easy to remember. All right, if you move down that table to the elevated or the yellow numbers that you're seeing, 120 to 129 for the top number, and again, less than 80 for the bottom number. Now, as we move down, we're changing colors. We're getting a little bit more in that red zone that we don't want to get to. But for sure, that 130 to 139 is what we call stage 1 hypertension. This, if your doctor gets readings and you show him a log or her a log where there are numbers that are in that range, most of the time, they may start you on a little bit of blood pressure medicine, or they may tell you, stop using salt or some of the other things, control your weight. some of the other things that can help control your blood pressure. Definitely when we get up to the next level, which is the 140 or higher, and then 90 or higher, that's when we're really going to see the healthcare providers start to use some control methods, including medications usually. And that's called stage 2, high blood pressure. And finally, down at the bottom, the red or hypertensive crisis is when the blood pressure is higher than 180 and or, so it doesn't have to be both, remember, higher than 180 top number and higher than 120 for the bottom number. Really important to remember that. So that's why I gave you this chart. So when you look at your numbers, you can make an educated guess as to what might be happening, because we want to control this. It's all about control in terms of blood pressure. If we can control the blood pressure, sometimes we cannot control whether we get hypertension or not. And we'll talk about those in a second when we talk about risk factors. There are some things that are uncontrollable, but what we can control is how well we control the hypertension, which is really, really important. All right, any questions? Anybody have any questions so far about this table or anything we've talked about so far? All right, we're going to move on, and we're going to talk a little bit more about these numbers. And I'm actually going to share my screen again and see if we can get this video to work. Share. There we go. This is a video from the American Heart Association.
130, just another number, right? Think again. It can mean all sorts of bad things. Swimming is great, but swimming with 130 sharks is a bad idea. 130 is too much of a lot of things, and it's too high for blood pressure. A blood pressure reading of 130 over 80 or higher means you're more likely to have a stroke or heart attack. Visit heart.org/HBP to find out more about controlling your blood pressure.
All right, and again, that was just a reminder of some of the things that we've just talked about, so you can remember that.
You know, my wife's like, what'd you do? After, 6 months of doing this, she's seeing all the changes that are happening. And she says, I want to do this.
Yeah.
Sorry, the ad had to come on, right? There we go. All right, here we go. Back to the Zoom. All right, and we're going to turn our PowerPoint back on. Okay. All right, so
You're still stuck on the Chrome screen share.
all right, let me stop that one. Thank you. And we'll go back to here. I'm just going to go to this one. How's that?
That's good.
Now you
That's
should
good.
be seeing the PowerPoint, right? Okay, thank you. All right, so why is hypertension often called the silent killer? Why? Because most of the time there are no obvious symptoms. So people go all the time, unless you check your blood pressure or get your blood pressure checked on a regular basis, there's not really any symptoms. There are certain physical traits and lifestyle choices that can put you at greater risk for high blood pressure, but left untreated, the damage that is being caused, remember we talked about that damage when we were talking about our pump and our hoses and how they can burst. The damage can be happening without us even knowing it. And again, that's why it's often called the silent killer. So that's why we're here tonight to talk about managing blood pressure. You know, most people, when we talk about blood pressure, we'll say to have, when was the last time you checked your blood pressure? And most people say, well, I checked it, 5 years ago when I went to the doctor, that kind of thing. So how often should we check our blood pressure? Well, as part of your health awareness, you should check your blood pressure. If it is not elevated, you should check your blood pressure about once a month as part of your health awareness. You can do that at home, you can do that in Walmart, you can do that at a doctor's office, but most of us don't have to go to the doctor that often, but you should check it about monthly. If you have been diagnosed with hypertension, you should probably check your blood pressure more often than that and do a blood pressure log so that you can help your care provider do a better job of controlling your disease process. So here are some of the risk factors. And again, we talked about that some of those were controllable and some of them are not controllable. So those that can be controlled are on the left side. Those that cannot be controlled are on the right side. Some of you will remember hearing some of the commercials about things like elevated cholesterol. Sometimes it's just in the genes. It's genetic. Sometimes it has to do with your gender. So males are more likely to develop hypertension than females. But that doesn't mean females should not be aware of it. We should. If you have other disease processes like chronic kidney disease or sleep apnea, that's another thing that can cause, be very difficult to control and is a definite risk factor for hypertension. Family history, if your mama and daddy had high blood pressure, then likely you're going to have high blood pressure. And again, not a whole lot you can do about it. You can help to control it with some of those things on the left, but you have to control it and you have to take control of those things so that you can control your health. And then of course, race and ethnicity, sometimes even socioeconomic status and psychosocial stress are big risk factors for blood pressure. If you're under a lot of stress, and if you're under a lot of stress all the time, it can affect your blood pressure. Things like basic living needs, medication, or the availability of that medication, availability to healthcare professionals, and the ability to adopt lifestyle changes can obviously affect your control. So let's talk about that left side of the screen. What are some things that we can control? Again, cigarette smoking and exposure to secondhand smoke can be controlled and should be controlled. Diabetes, being obese or overweight, high cholesterol. Again, how do we control that? By our diet and medications. And then we can control an unhealthy diet. We want that diet to be low in sodium. So we don't want an unhealthy diet that's high in sodium. We don't want it to be low in potassium. We want it to be moderate in that potassium. And then we want to make sure we control not drinking too much alcohol. And then physical inactivity can be controlled. We need to increase our activity levels. And we'll talk more about those in a second. All right, any questions about those factors? So the ones on the right, we really don't have a lot of control over. The ones on the left, we do. Pick what you can control and work on that. And we'll talk more about that in a second. So you have in your handouts, the handout that we've already looked at, it's the steps for accurate blood pressure measurement. And it's steps 1, 2, 3, 4, 5, and 6. So what are you gonna do when you're checking your blood pressure, even at home? These are some of the things that you need to do, and these are really, really important. I had somebody come in just a few minutes ago and wanted me to check their blood pressure, and they had been running around a little bit, and when we checked it, it was a little bit high. The systolic number was a little bit high. Well, we can see that it was because he was running around. So what should we do? We should seat ourselves with our feet flat on the floor and relax and quiet for about 5 minutes. If you have not already emptied your bladder, you should do that before you try to take your blood pressure, and avoid any caffeine before you take your blood pressure. No exercise or smoking about 30 minutes before that blood pressure check, and remove the clothing from the arm. So when's a good time to check that blood pressure then? What do you think would be a good time to check that blood pressure? Yeah, probably in the morning when you get up and you start your routine, before you get too much into the your breakfast and those kinds of things. You want to go ahead and check that blood pressure. Another good time to check it, if you need to do it twice a day, depending on your healthcare provider, is right before dinner at night. So do the same thing, you know, sit quietly for the 5 minutes, then check your blood pressure. Make sure, number 2, that you use a properly validated, calibrated blood pressure measurement device. So at all of your facilities, if you brought a blood pressure cuff or device with you, we have people at all of the facilities that can check those devices for you and make sure that they are working properly. You want to make sure that you use the proper cuff size. So they come in small, adult, or adult and large adult, and then the adult thigh size. So we want to make sure you have the right cuff size. It's usually based on the arm circumference. Okay. And you can buy larger cuffs if you need that for at home as well. So number 3 is we record the blood pressure in both arms using the arm with the higher reading, and wait about 1 to 2 minutes between checking the blood pressure, and then record the systolic over the diastolic, or the top number over the bottom number as it's read on your electronic device. And then later we'll talk about that you can use that average. Your healthcare provider will use an average and provide that to your healthcare provider when you go to visit that healthcare provider. All right. So we're going to look at another short video. And this is, again, how to check your blood pressure at home. Some real talk about that.
Okay, let's have a real talk about blood pressure. Do you monitor yours regularly? It's something everyone with high blood pressure should do, but it's something most people don't know how to do correctly. Checking your blood pressure regularly will help let you know if you have it under control. It will also help you start to understand which factors are putting you at high risk for stroke and heart attack. Before I get to that though, I just want to stress one thing. If you have high blood pressure, you should talk to your doctor to figure out how frequently you should be checking it at home. For most people, taking your blood pressure twice in the morning and twice in the evening, even just for a week, will help you and your doctor get a better understanding of your blood pressure. For morning readings, it's best to take those before you take your blood pressure medication. It's also very important to avoid exercise, caffeine, or tobacco at least 30 minutes prior to testing, since those can affect your levels. Now, let's move on to talk about the proper way to measure your blood pressure at home. Nearly half adults in the U.S. have high blood pressure and are at high risk for stroke and heart attack. So self-measuring is one of the easiest ways to be proactive about our health. Here I have my blood pressure monitoring device. It's easy to use and it helps me get an accurate reading. Be sure to get an automated device with an upper arm cuff. That's the type doctors recommend. The first thing you want to do is find a quiet place to sit where your back is in an upright, stable position. A dining room chair is great. You want to make sure the chair isn't too soft so your body is fully supported. Sit with your feet flat on the floor and don't cross your legs or ankles. If you need to use the bathroom, make sure you go before you do your reading. Next, rest your arm on a flat surface with your palm facing up. Place the blood pressure cuff on your bare upper arm just above your elbow. Your arm should be relaxed and resting so the cuff is at the same height as your heart. Now rest quietly for 5 minutes before taking the first measurement. Avoid talking while taking your blood pressure measurement. Once your first measurement is completed, write down the blood pressure numbers and pulse that are displayed on the device. Wait 1 minute and then repeat this process again. As you just saw, it's important to check your two measurements at around the same time each morning and evening. At your next doctor's visit, be sure to share your blood pressure numbers so you can discuss the numbers and so your care plan can be changed if necessary. That's it. Not bad, right? Measuring your blood pressure at home is easy to do and a great way to stay on top of your health. If you have more questions about managing or measuring your blood pressure overall, visit the website.
It's time for me to get set up for therapy, and I use this room as my office. But the desk is over here, and so when I'm seated at the desk, this is the background. I have my therapy session, which is virtual, and I find myself looking really forward to it nowadays because I found a therapist I really like. I had to switch a few times until I found one that I loved, but now
Always have to stop
a lot. So I'm gonna hop on that, and I will catch up with y'all in like 30-45 minutes. Let's talk about.
Okay. All right, now, next thing we're gonna do. Here we go. All right, we're gonna take some time now. On the back side of your picture that you have like this, you have a My Blood Pressure log. So we're gonna have you fill out your name at the top, your blood pressure goal. Now you've learned tonight what your blood pressure goal should be. So who can tell me what their blood pressure goal should be? 120/80, that's right, perfect. So that's your blood pressure goal. You can discuss that with your healthcare provider. But tonight we're going to put your first entry on your blood pressure log. So today's date, it'll be your PM for today, okay? And then you can start using this on a regular basis. So we want all the groups. You have students there from Carteret Community College that are here to help you. And we're going to do the first numbers on our log. So if you don't have your own blood pressure cuff with you, there are blood pressure cuffs at the facility. So make sure each of you have somebody to help you with that. So you Fort Benjamin folks, you can just check each other's blood pressure. How's that? And I think, let's see. Carteret, you've got a person you can do. There you go. Each other. All right. So, okay. So we're going to help us. Got this task over here. Okay, and you stay where you are, we'll come to you. The blood pressure test. And you guys are doing just right, so sit in the chair with your back supported, feet on the floor, perfect, that's exactly right. And we're checking those blood pressures. You do that with- I know it was several while ago. There. It doesn't have
And then we keep looking in the labs that we do this to go on better.
So James, it says that this is getting ready to go to sleep.
Thank you.
Is it a touch screen?
Yeah.
Just touch it. It's a little touchy like me.
I got it, James, thanks. Thanks. Melinda's help. I forgot that they were touch screens. nice to have.
Well, I got a wrist monitor. Yeah. But most people, that's what they use. That's what I got here, but I'm not using that.
It's
10 years
never
already.
quite the same, but.
Yeah, exactly. So your doctor knows that if you keep your log, make sure your doctor knows that. But it is better to have that upper arm.
It probably doesn't work.
Probably batteries.
If I'm not used to this, I think that mom and dad see now.
Was.
Battery is in that. Oh, yes. Unable to determine. When you're getting with children, pieces like the mommy, that they're getting old. Yeah.
How you guys doing? Almost, we're still moving around the room.
I think we're almost done.
Okay, sounds good. Get some of those first numbers done.
Okay, we can't get Chris. You said that every time they try to take it with the machine, it won't work.
We gotta take our manual one.
Yeah. You gotta cut it, we don't have to. You have to cut here. She didn't get it registered, her, those machines, it doesn't. I haven't played with it. I checked on it every. But you had to complain on her. I'm gonna go down and go. It just did, it just did. But then I'm high blood. Yeah. Does it land all right? And his arm is worse sometimes they can. It never works for my. What do you feel right when yeah. Well, it still might not take. Okay, I'll try it again just now. You don't always think.
We've got one here, no blood pressure. The number to call is 911. Just in case you can't remember. Somebody call 911, what's the number?
Well, it's more does that sometimes, and it's frustrating, it makes you think it's gonna be real high when you try to put that up again.
Yeah.
Mine did it, and mine was all right. Get the 80, you Angela says, certainly get the. Okay. Yes.
Yeah, that's okay.
Okay. I said, okay. I see your thing on Facebook. Actually, it's more like Janice and Angela. I can see Janice.
You can tell they're all keen, can't you?
Yeah. And the brothers have birthdays. Oh, that's good. 127 already, and your pulse is 58. You know that, don't you?
Yeah, I walk,
Okay.
but I was in Raleigh today, so that's why it's a little hot.
And you were looking to get here.
While we're finishing the blood pressures, does anybody have any questions about anything so far?
Come Ella, that's really making you speak on it.
So it can make a little bit of difference in which arm you take. The thing to remember is to take it the same arm each time.
Got it. 139, ooh, you're a little bit high in that 130s. 39 or 79. You're right, 79 is good. Yeah. She's working on it right there in the PM.
That's pretty good.
39/79 and total 77. I think they just DL over here. He's gonna be high because he has a little Camille. I'm just kidding. I'm just kidding. I'm just kidding.
All right, did we get everything finished? I'll finish.
Yeah.
All right, good job. All right, so you have your start on your log, your blood pressure log. So we want you to keep that up daily with your blood pressure devices, especially if you have been already diagnosed with hypertension. And remember, hypertension has no real symptoms. You know, sometimes people will complain a little bit of a headache, but usually by the time they're starting to complain of those kinds of things, it usually means that they've had the hypertension for a little while. So make sure that you keep an eye on those things. It gives the healthcare provider a time lapse look at what you're doing. All right, I'm gonna share again. We're gonna go back to the PowerPoint.
Well, we have a patient over at where one of our students is, Miss Markham.
Okay.
Her blood pressure is 200/110,
Oh,
but she is asymptomatic. They told her to get with her doctor.
yes.
Very good.
Very good. Thank you. All right, let's see. All right, so this is where we are with the blood pressure log. And that we've just been doing that again. It helps your provider to see what you're doing and how you're doing. One other thing to remember about that log is if you've had any unusual things to happen to you during that particular day, for whatever reason, and you're making that log note, put a little note there about what has happened. Again, that will help your provider to see the big picture in terms of your blood pressure. All right, so the next part of our discussion tonight is talking about making changes that matter. So these are the things, and I love this, I pulled off of the website, the American Heart Association website, is to reclaim your rhythm. So it's all about taking control of your health. And here are some things that we can do to take control of our health. So eat a well-balanced diet that's low in salt. That's a hard one sometimes for, especially us, we in Carteret County, really all of us in the South, we like our salt and salted processed meats, especially like smoked meats and things like that. Limit alcohol, enjoy regular physical activity. Now, I've had patients always that would say, I'm having trouble with my knees, or I'm having trouble with my hips. Well, enjoying regular physical activity does not mean you have to get up and walk or run or doing, those kinds of things. It means just that, something physical, which can even be chair exercises. On the YouTube, on the web, you can go to YouTube and find so many, if you'll just plug in chair exercises. There's, some that last for 5 minutes, some that last for 10 minutes, some that last for 30 minutes even. And it's chair exercises, things that you can do right in your chair, just to increase your physical activity.
Miss Mark, if I could interrupt, if they don't have internet in their home, there's also a lady that has a television show on PBS that she does chair exercises.
Yes,
So I can't think of the name of the show.
that is true.
It's a good show.
So again, it's something you can do on a regular basis. Usually daily, you want to get some kind of physical activity.
You sit and be fit.
Sit and
That's the name of it. Sit and be fit.
it is great. All right, and we want us to manage our stress. There's lots of ways to manage your stress. You have to find your way to manage that stress, whatever it is. Everybody has their own way of doing that. What we don't want you to do is to turn to things to manage your stress that will make your blood pressure worse, like overeating or alcohol in high consumption or other substance abuse. So we want you to learn how to manage your stress in a way that will help your blood pressure. Maintain a healthy weight, quit smoking, take your medications properly. And I cannot say enough about making sure that you take your medicines. As a nurse, I've seen multiple times patients start taking an antihypertensive medicine, so a medicine that will lower your blood pressure, and because it makes you feel different, a lot of times patients will stop taking it and they don't tell their doctor about it. Now, if it makes you feel really bad, you do need to have a conversation with the physician or the healthcare provider about that medicine and about how you're feeling. But you do not just need to, you don't need to just stop taking it and not let your healthcare provider know. They need to know what is happening so that they can help you be in control. And again, that last statement, work together with your doctor. Very, very important, or whoever your provider is. Very, very important to reclaim your rhythm. Here's some information about a heart healthy diet, some things on the left to eat, like fruits and vegetables, whole grains. The more whole grains that are in it, the better they are for you. Low fat dairy products, skinless poultry and fish. And of course, around here, we love our fish. And then nuts and legumes, and then the non-tropical vegetable oils. We need to limit saturated and trans fats, sodium and red meat, and sweets and sugar sweetened beverages. Those are some things that we need to limit on a regular basis.
Non-tropical vegetable oils like canola oil.
Yes, or olive oil is a non-tropical vegetable.
But tropical would be like
Coconut oil, yeah, that would be correct. Yeah. Okay. Anybody have any questions about any of those? I'm getting some questions here, so I just want to make sure if you guys have any questions, and you're welcome to ask the people that are there, the nursing students. They can help you as well. All right. And speaking of increasing activity, I have another video that I want to share with you. And this one's called Get Down with Your Blood Pressure. I love this.
We're gonna dance.
We're gonna dance, that's right. This crowd gets down, let me just tell you.
Get it slippy, coffee check. Talk to doctor now and share it. Get it slippy,
Get it? Slip it? Cuff it? Check it. High blood pressure silently affects millions of Americans. Staying on top of your blood pressure is as simple as these 4 easy steps. Self-monitoring is power. Visit manageyourbp.org to learn more.
It is fun, huh? Let's make sure.
My first year teaching, less.
All right, and I don't think. Yep, we're at the end of the PowerPoint. So the last thing, I just want to reiterate to you that it is important for you to have the power, and the tools that we've given you tonight are things that can help you have the power to control your blood pressure, control your health. Again, does anybody have any questions that they want to talk about? Anything specific they want to talk about? You guys are really quiet in the Zoom world.
What does it mean when blood pressure, like, is there such a thing as a low blood pressure? What does that mean?
Okay, so we talked a little bit about that before you got here, Dr. Mancini, about blood pressure being too low. Sometimes that can mean that the blood doesn't get all the way to the end, remember? So we don't want it to be too low either. So that's another reason. Sometimes when we take medicines, the medicines can make it go too low, and we have to regulate those medicines so that it maintains the level that it's supposed to be. So what would be too low? Anything much between that 90 to 100 for the top number can be a little bit too low, and you want to talk to your doctor or healthcare provider about that. And then the bottom number is below 60. Okay. It's a great question.
Dehydration would cause low blood pressure.
So dehydration is a good, excellent example of what something that can cause your blood pressure to go too low. That is correct. When patients go into shock after they've been hurt or they're sick, you'll see the blood pressures drop as well.
What's the best thing to do at that point?
So hydrate, if at all possible, and maintain hydration.
Yeah.
Maintain that hydration is important. And hydrating with water, you know, my students, I know they get tired of me telling them, but it's all about hydrating with water. And that's the best thing to hydrate with.
My energy drinks.
Not energy drinks. Energy drinks can cause your blood pressure to go way, 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 way high. Caffeine, of course, can affect your blood pressure as well. And sugar in general can affect your blood pressure. So we want to maintain that in control. Remember, diabetes, patients with diabetes, because of their high blood sugar levels, it can also affect their blood pressure. So, any other questions that you can think of? Well, that's good. Let's just go back over what we've learned at the end. Make sure that we've you have a handout that looks like this that says, what can I do to improve my blood pressure? This is some of the things that we've already talked about: the weight reduction, the DASH diet, the reduce or restrict that sodium intake, physical activity, and then the moderation of alcohol consumption.
Ms. Markham,
Yes.
What can people use in place of salt in their diet if they, have been advised to limit their salt intake?
The best thing to use, Yes, that's a great question. So what can we season with if we can't season with salt? And you have to be very, very careful, especially if you have any kidney disease, that you don't use some of the salt substitutes, that you talk with your provider about those salt substitutes. So the best thing to season with are natural herbs and things like that, rather than the salt or salt substitutes. Pepper's okay. But and natural herbs and spices like that can help. Oregano and those kinds of things. The basil, great. Cinnamon, all kinds of things like that are great substitutes for salt. So that was a great question as well.
I noticed that the machine you used also gave a pulse number. Are there ranges for that are important?
Okay, so Dr. Mancini has asked a question about the pulse, because most machines that check your blood pressure also check your pulse at the same time. So what's the difference between blood pressure and pulse, and where should your pulse be? So a pulse normal for an adult would be somewhere between 60 and 90. 60 and 90. If it gets much above that 90 to 100 range, you want to start thinking about that might be too high. Anything over 100, we call that tachycardia. And we want to make sure that we monitor that as well. So your pulse is the number of beats per minute. And it's not always, it doesn't always have an effect on the blood pressure. It can, but it doesn't always have to. And they don't always correlate. So if your blood pressure goes up, doesn't mean that your pulse will necessarily go up or down. So that's not an effect that you see usually in terms of blood pressure and pulse. But that's a great question. Okay. Anything else?
Go ahead.
Sea salt and that pink salt, is that?
That is a great question.
Himalayan.
Sea salt and the Himalayan, yeah.
Pink salt, yeah.
Pink salt. So if you're going to use salt, those are better salts to use. That is correct. There's less sodium in them. So, but if it depends on how your healthcare provider has asked you to do. If they've asked you to do a reduced sodium diet, you could probably use some of those types of salt. If you're supposed to be on a low sodium or no sodium, no extra sodium, then you would have to not use those. But those are definitely better for you. Great question. You guys are really thinking. That's a really good question.
What about the sugar substitutes?
So sugar substitutes will not have an effect necessarily on your blood pressure. So what do sugar substitutes do? Sometimes they can cause some issues with your blood sugar levels, and it kind of tricks your brain into doing some things that are not as healthy for you. So it also depends on what type of sugar substitute. Sometimes some sugar substitutes, and we have a friend, I'll just tell you an example. We have a friend who they have diabetes, and we saw them about 2 weeks ago, and he said that he found a package of cookies that were no sugar added to the cookies. And so he sat down and he ate the entire package of no sugar because he had diabetes. He wanted those those cookies so bad. And one leads to another, and pretty soon he had eaten the whole package. Well, some sugar substitutes have a lot of alcohol in them, or sorbitol. It's a type of alcohol. but it's also a laxative. And so he told us, he said he spent the next day in the bathroom. Now, some of you may have had similar experiences. You know, I had a student one time that said they ate a whole package of those Mentos because they're, you know, supposed to be sugar-free. It's sorbitol, basically, and said the same thing. You know, he spent the next day in the bathroom because nothing but laxative. So you just have to be very, very careful that of what sugar substitutes that you're using. Some of the more natural sugar substitutes are better for you, but you have to be very careful with those. But that was a great question as well.
And with the sugar might not have an immediate effect, but it would have more of a long-term effect, right?
The sugar in the blood or the sugar in the diet.
Well, I'm talking about affecting the sugar in the blood. The more sugar you bring in, the more it's going to.
Yes, it'll cause the hyperglycemia or the blood sugars to go up. That's correct. And remember, long-term, the blood sugar, what does the blood sugar do? A long-term effect of the blood sugar in the body, the sugar can get inside of those blood vessels and plaque those blood vessels up and cause them to narrow and therefore cause complications. So you guys know all the complications. You've seen them in your family and friends. So some of the complications of diabetes are things to do with the little teeny tiny blood vessels in the bodies, like the eyes. So patients with diabetes will go blind, or their nerves, peripheral neuropathy. Okay, and so they have a problem with losing their feeling, like in their feet, or losing the circulation in their feet, and therefore it leads to amputation and things like that. And kidneys is another place where there's really, really, really small blood vessels. And when they get clogged up, then they can't do what they're supposed to do. So it kills those kidneys and therefore causes the kidney disease. Those are some examples. So we want to control that glycemia or the level of blood sugar in the body, for sure. By the way, I'll just put a plug in. So for exercise, physical activity, anytime any of us, patients with diabetes or not, your physical activity will increase your insulin sensitivity. Now you hear a lot about that on commercials on TV, but what does that mean? It means that you can use the sugar you take in better because your insulin is working better. And that's for all of us, whether we have diabetes or not. Increasing our activity, physical activity. Okay? Any questions about any of those things? These are great questions. We're happy to talk to you about these things. Help promote your health. All right. Well, we have enjoyed being here with you. I want to thank the students for coming and helping with the blood pressures. If you have any questions, feel free to ask. If you have friends or family, you want to take some of these blood pressure, these handouts that we have, there's extras in all the areas. So we want you to take those to your friends and family. We'd be happy to share those with you. And thank you for coming. If there's not any other questions, we're going to say thank you and good night. Have a good evening. Thank you.